And we're going to be joined on the line now by Dr Phathokuhle Zondi. She is a sports and exercise medicine physician and CEO of the Sports Science Institute of South Africa. Dr Zondi is the current chairperson of the Medical Commission for the Sport South African Confederation and Olympic Committee. A very good morning and a welcome to Morning Live, Doctor.
Good morning, Zaid, and good morning to the listeners.
So many of the Olympic qualifying events have been postponed. What is the physiological impact on athletes who plan meticulously to peak at very specific times in a calendar year?
A very disruptive time for athletes, Zaiden, both in terms of their planning and certainly, as you've alluded to, some physiological and certainly mental health aspects. Physically, athletes will have periodized or planned their training around competition at this period. And so with competitions being cancelled, those plans and that training will have to change. And very importantly, there's a impact that's not spoken about that's related to motivation and mental health, specifically at these times.
What has been the discussion between yourself and the rest of the Medical Commission at SASCOC?
Our discussions have largely been focused on preserving and maintaining athletes' health. So certainly amidst the coronavirus, our advice has been centered around preventative measures as being advised by WHO. And then we've also been fielding concerns from athletes that are very personal and specific around, again, competitions, planning, where they should be, who they should be surrounding themselves with, how they should restructure their lives and their goals.
There's a feeling that the health of athletes puts them at the top end of the 90% who we've been told even if they contract the virus won't be severely affected by it. Is that correct, just because of the physical conditioning of our athletes?
That's one that many of us as clinicians are currently discussing animatedly. Of course, athletes generally by their very nature are very healthy and in good physical and physiological condition. However, at times of competition or increased physiological strain, when they're training very hard, they are relatively immunocompromised. But of course, right now, we are still gathering thoughts as clinicians of what the implications are. I think by and large, we are confident that athletes that have got underlying good health and no medical conditions would, as you correctly say, be able to withstand the severe consequences of coronavirus.
What is the psychological impact of the state of this uncertainty for a number of the sports people? Because surely that's also going to have an effect on them.
Valen, can I just make sure I heard you correctly? Did you ask about psychological impact?
Yes, of all of these delays and postponements.
Absolutely. Mental health is a critical component of overall health. And in these testing times, there's a number of triggers or aspects that could impact mental health. Perhaps let me just highlight three that are front of mind as I engage with athletes. The first one is athletes and non-athletes alike, of course, are feeling very anxious in light of the global pandemic. You know, the anxiety relating to personal health, to their families, and to public health. Secondly, with financial security, where competition is postponed, and this is linked to income, this is causing heightened anxiety associated with financial insecurity. And perhaps the last thing I should highlight is that for athletes, of course, training and competition is a vocation. So cancelling events impacts their sense of motivation, purpose, and meaning.
What has been your advice to athletes that have come forward to you that are feeling anxious, that don't know what is the way forward? They're waiting for word from the International Olympic Committee, and they're also trying to figure out how they are going to go about training during this time.
We've been very clear in our messaging. So firstly, control the controllables, and the first thing is your health. So follow the WHO and the Department of Health advice on preventative measures. The second one related to mental health is that it'll be important to set new goals, and there might have to be short-term goals, weekly goals, training goals, and personal goals, just in light of the uncertainty with competitions that have been postponed. The next message is around connecting with those and that which anchors you. So certainly just in terms of family, staying in touch with them, in terms of practice, whatever that practice might be that anchors you, keeping active, meditating, prayer. And then lastly, there are athletes who have underlying mental health concerns, and we've just encouraged them to stay connected with their medical practitioners and with their families to make sure that they've got the correct dosage of medication and, of course, they've got the appropriate amount of support around them.
All right. Thank you very much to Dr. Phathokuhle Zondi. She is the CEO of the Sports Science Institute of South Africa, herself a sports and exercise medicine physician. Thank you so much for chatting to us here on Morning Live.